Hello and welcome to the Southern 7 podcast. I'm Shauna Ryan, Community Outreach Coordinator for Southern 7 Health Department and Head Start. Southern 7's main office is located in Olin, Illinois, with clinic offices and Head Start sites serving each of the lower 7 counties in Illinois. The Southern 7 podcast is a service provided by Southern 7 Health Department to help you and your family live better and stay healthy. If you like today's episode, make sure to check out all of our podcasts by visiting southern7.org and downloading the Southern 7 app. Well, listener, we are so glad to have you with us today because this is an episode that we have been planning here at Southern 7 Health Department for several months. And I'm so excited that we're finally able to talk about it and get it out to you and to our region here in Southern Illinois. We are going to be talking about genetic cancer testing. Now, if that doesn't sound like something that's just really overly exciting, you're going to want to listen to this and find out why we are so excited about it, because being able to prevent cancers has just gone into a whole new level. And here at Southern 7 Health Department, we are very excited to be able to bring that to folks in our region. This is a great opportunity for you to talk with your family members about what they can do to be tested, to find out what cancers are a potential risk for your family. So stick around. We'll be back with today's episode right after this.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Do you live in one of the Southern 7 counties in Illinois? Then you could benefit from the many programs and services offered through Southern 7 Health Department, including Head Start. To find out more, call Southern 7 at 618-634-2297 or visit southern7.org today.
634-2297.
Welcome back to the Southern 7 podcast. I'm Shauna Ryan. Here today with me, we have a couple of ladies who are going to talk with us about a brand new program here at Southern 7 Health Department, and I want to welcome them aboard. We have Rhonda Andrews-Ray and Teresa Wilburn. Good to have you guys with me today. I appreciate it.
Good morning, Shauna.
We've got a program that we've really been planning for quite a while. But before we go into that, I'd like for you to introduce yourself and tell what you do here at the department. Rhonda, let's start with you.
My name is Rhonda Andrews-Ray. I am the Executive Director for Southern 7. I've been here about 5 years. Been in public health for 29. I can't believe it's been 29 years this year.
Exactly. That's a long time.
My name's Teresa Wilburn. I'm the Director of Nursing for Southern 7, and I've been here right at 4 years now.
Okay, very good, ladies. Well, you both bring a lot of experience to the table when it comes to what we're going to talk about today. But then again, for the rest of us, it is still kind of new and what's going on. And the topic of today is genetic testing. Kind of a new idea for us, but not for the public at large. What can you tell us? What is genetic testing for cancer?
Yeah, so genetic cancer testing, it's a process that involves taking one's individual genes to identify specific mutations within those genes that makes a person at risk for developing certain types of cancer. By understanding that, we can take that information and use it to take a proactive approach to our healthcare.
Okay, so for the residents that live in our region, it's particularly important because we do see a high incident rate of cancer.
Yes.
But we live in a health desert, just like we live in a food desert down here. And so it's hard for people to get some of that advanced care. So why is this so important for our region? What should people be thinking about?
I think this information can empower people to know what they are at risk for. Mm-hmm. They can use this information to maybe screen earlier for certain types of cancer. There are some interventions that your healthcare provider can talk to you about decreasing your risk of developing that cancer. Now, I think it's very important to note that a genetic cancer screening is not going to say you're never going to get cancer, because we don't know all the ways that a person can develop cancer. They can be environmental, they could be, something that you're doing, like smoking, or, we all know that those types of things can develop cancer. But these specific cancers that we're testing for, or these gene mutations that we're testing for, can help you just be more educated and more involved in your own healthcare.
So just because you would test positive for a certain cancer doesn't necessarily mean that you will develop that.
Correct. Right. Just because you test positive doesn't mean that you are for certain going to get this cancer. It just gives you a little bit more insight, so you can take a more proactive approach. Again, like earlier screening, earlier testing. You may, instead of waiting till age 50 to get a colonoscopy, 45 to get a colonoscopy, you might get those earlier.
Okay.
Right. Having a positive result on that test does mean that you're at higher risk for certain kinds of cancer. So like Teresa said, it's important that you take that information to your doctor. You tell your doctor that you have this mutation, and then your doctor can screen you, and they can kind of go outside of the guidelines, especially with insurance and that kind of thing, and say, look, this person is at risk for breast cancer, let's say, at an earlier age. So instead of getting a mammogram at 40, they may decide that you need to get one at 30. And start the screenings that way. And that way, they can either catch cancer at an earlier stage than they would have, or they can help to prevent it altogether. And some of them are preventable, like colorectal cancer.
So what are the cancers that this test is looking for?
So this specific test will test for, I believe, 9 different types or subtypes of cancer. And those include colon, breast, stomach, uterine, melanomas, prostate, ovarian, and pancreatic types of cancers. So that's a pretty broad range, and that's very informational to your healthcare. So again, like Rhonda said, take this information to your healthcare provider, and you can make some informed decisions on your personal healthcare.
Right. It's one of the few things out there that is tailored specifically for you. You hear about data and statistics and what happens in the public, and we're in a hot spot for different kinds of cancers. And so your general risk is this, but this is one test that'll tell you for sure if you're at a higher risk than the general population or not. So like I said, it's tailored for you.
And for those cancers that there aren't regular screenings for, like she mentioned, colonoscopies, mammograms,
Right.
some of those.
But ovarian, there's not.
There's not. So this helps your doctor to determine what kind of next steps you can
Exactly. And people with ovarian cancer can have BRCA mutations. I have a BRCA2 mutation, which puts me at higher risk for breast and ovarian cancer. I didn't know that until just a few years ago. I wished I would have known that about 20 years ago. So, it's important that even young people get these tests. We're testing people 18 years of age and older. So if your parents have had cancer or relatives or things like that, it makes it really important for those children, that if you're age of 18 or older, to get out and get those tests.
Well, and this is one of those conversations we normally don't like to have, but anymore, this new generation is talking about it and being proactive with their health care and sitting around the kitchen table with grandma. Hey, grandma, what's going on?
Yeah, Thanksgiving dinner, pass the turkey. Did you hear how grandpa died?
Yeah.
That kind of thing.
Yeah. Well, I can remember when I was going through breast cancer treatment myself, and the doctor asking me, does this run in your family?
Right.
I said, I have no idea.
Yeah.
My grandmother never thought about breast cancer. She was keeping her children fed and so on and so on. So for us, this gives us that ability to help our kids move forward. Now, as far as the test, when you're looking at that next generation, does this help us in saying, okay, we can screen earlier for tests? Because, for example, colonoscopies, now you can screen at 45. So if you test positive, is this going to help your children be able to test earlier? What are the benefits to the next generations there?
Yes.
Right. So if you have a positive result, meaning that you have a genetic mutation, then that qualifies your children to also be tested at no cost. So that's really neat, I guess, for those, like, you can know what you're at risk for. So yes, that would increase the earlier screening dates for those children as well. I don't know, it would all be determined by your healthcare provider. Again, informed
Right.
decisions, bringing this information to your healthcare provider, your primary care, and letting them know, hey, I know this information now, so what do we do about it?
Right. And Teresa made a really good point when she talked about it being a no cost. This test is one of those that is a very low cost test. And at the most, I believe somebody would owe is $200 or $250. I can't remember which it is. Most people, actually, I don't know if I could say most people, but a lot of people, if you've had cancer in your family or if you personally have had cancer, a lot of those people will qualify for a no charge test. So that makes it really important and really no reason at all why you shouldn't have the test done. They will draw blood, they will do a saliva sample, and then the Invitae, which is the company that we're doing the testing from, will send you back a text message saying, would you like to continue? Your cost is going to be X. And at that time, you can decide, do I want to pay this and find out, or do I not? So you will know going into the test how much money it's going to cost you.
Right.
And go ahead.
And they work with, Invitae works with several insurance companies as well.
Right.
So it will be individualized once you put all your information into the portal. Once we'll go ahead and draw the blood and send it to Invitae, and they take care of everything as far as the billing and insurance filing, and we'll let you know exactly what it would cost you before the test is ran.
Okay, so let's talk about Invitae for just a minute, because that's a new term even for me. Tell us a little bit about that company. How did we get to partner with them on this?
Well, Invitae is a company that's been around for quite a while. They've kind of flown under the radar, but they're really starting to pick up some traction now because they offer these tests at such a low cost. Some people may have heard the term Myriad out there, which is another company that's done genetic testing. And I can remember years ago when I looked into it, it was about $1,200 to get a test. Well, there was no way you were going to spend $1,200 on something that's just going to, tell you some information and may or may not help you. So, but with Invitae, there's really no reason not to do it because a lot of people, like I said, will qualify for a no-cost test. Invitae is another company that offers free genetic counseling. So if you do get a positive mutation back, they can set you up for a free 1-hour appointment with a genetic physician who will work with you and talk to you about what your risks are, give you a report that you can take back to your doctor and answer any questions that you have. So that's another benefit that you don't necessarily get from other companies.
Oh, very good. Okay, great. Well, that gives me more information on Invitae that I didn't have before as far as that connection. So thank you there. Now, what should a patient do if they test positive for certain cancers? What would be their next step in their mind? We've talked a little bit about it.
Right. Their very next step would be to call their healthcare provider, their primary care physician, let them know, make an appointment, and you go see them. Take some time, 15, 30 minutes to talk about my results. These are my personal results, and share those with your doctor. They then determine what types of screening you want to do next. Depending on any mutations that you have, a colon mutation, you might want to schedule a colonoscopy right away. Mm-hmm. A breast cancer, you may want to schedule a mammogram right away. So earlier screenings are going to lead to earlier detections of those cancers if they are present. And we all know that earlier detection means you're treated earlier. And every time you hear someone that's diagnosed with cancer, the first thing you want to know is how early did you catch it? Because we all know that the survival rates are better when you catch it earlier.
Exactly. Now, as far as this test goes, is there an age limit? You have to be a certain age to
You
do
do
this?
have to be 18 in
Okay.
order to do this particular test. And that does also apply if you have a positive family member. They do need to be 18 years old.
Okay. So very easily done at
Yes.
an early age and getting that process started.
Yes.
Okay, great. And can they just walk in off the street and get this done? What was the process of scheduling this with the department?
Right now, we're going to schedule at all of our clinics. So you can call our main line, 634-2297, and we can transfer you to the appropriate clinic, or you can call your local Southern 7 Health Department, depending on what county you're in, and schedule that, just like you would any other test at Health Department.
Now, Rhonda, you mentioned it's a blood draw or a saliva draw. Is it their option on what they can do?
So we're going to start with the blood draw option, and if the nurse is not able to obtain a blood sample, we will go with a saliva sample.
Okay.
Yeah.
And
The reason is saliva doesn't always test out. You have to not eat or drink 30 minutes before that test. And so somebody might be right on the line and have drank or something, and it'll dilute the sample and it won't test out. Blood tests out every time.
Right.
So that's another reason, too, why we're not just allowing walk-ins.
Right.
We've got to make sure you got that time. And about how long does it take to get your test results? Do you know?
Invitae tells us they'll have test results back anywhere from 21 to 28 days. It's kind of a little bit of a long process, but it's worth the wait.
Yeah. Well, and I know I did this myself. And you get a little card with contact information. It's a very simple process to do.
Yes.
It wasn't hard at all. Very good. Okay. Wow, we've covered a lot. Is there anything else that we want to share?
I don't think so.
I don't think so.
Okay.
I think if you want to get tested, call Southern 7 and set up your appointment.
Okay. And once again, that number was 618-634-2297. And you'll talk with someone there and they can direct you to the clinic office in your county. All right, ladies, thanks again. One more time. Anything else? Because this is one of those massive programs in my head that is really easy to explain.
Yeah.
It's just making sure that people understand that it is important for them to go ahead and start those conversations and making sure that they're talking with their kids, talking with their parents.
Yeah. Get your
that
family
information.
history. Get that
Yeah.
information. What's going to help you have the best health outcome that you can have.
Exactly. And yeah, that's what this is all about. And that's why the health department is so involved.
Yes.
We are all about preventative health and making sure that our region gets what they need. And, we sit in a hot spot for a lot of cancers.
A lot of them.
Oh, a lot. So it's important that, we get this information out to folks. And now that it's made easily accessible, almost free in some cases, it doesn't hurt to, call and talk with our nurses, find out if you qualify, find out what is best for you. Right. And we'll have information on our website here in the coming days, make sure that you've got something at hand that you can review as well. Right. All right.
Sounds good.
Okay. Well, thanks again, ladies.
Thank you.
I'm hoping that this program is going to go very well, and it's
think
something
it will.
we've needed for a long time.
I think it will.
I think we're going to hear a lot about genetics in a lot of different ways now. It's it's cutting edge. It's
precision health.
It's precision health. It's specific to you and you alone, and that's I think that's awesome.
Well, and I know as I start to go to other appointments, doctor's appointments, we're starting to get the questionnaires.
Right.
Have you participated in this? And so, yeah, we're going to see this more and more.
Yeah.
Right.
Okay. Well, thanks again, ladies. I appreciate
Thank you.
helping me with this and getting the word out. Folks, if you'd like more information about our genetic cancer testing program, once again, you can give us a call at 618-634-2297. We'll make sure you get that information. You can also visit us online at southern7.org and download the Southern 7 app to have all the information right at your fingertips. Thanks again for listening. I hope you enjoyed this as much as I did bringing it to you. From all of us here at Southern 7 Health Department, have a great day.